Over the last 4 or 5 years, I've visited several dozen dental practices. And one of my key interests is in productivity, that is, how dentists produce and how easy it is to produce. So in the practices, I was very interested to see some practices, they can comfortably produce $7,500 worth of dentistry per day. And other practices you go into, they struggle to produce $2,000 or $2,500 of dentistry per day. And initially I would have thought that the practices where they're doing $7,500 per day would be high pressure practices. They'd be practices where you really were working, focusing, and it was very, very tense and high pressure. And I would have thought the practices where they're producing much less dentistry, $2,000 a day, would be the practices where it was easygoing, relaxed, nothing much to do. The dentist had a very easy life in those practices. But what I found was actually the opposite, and that's really the paradox. I found that the $2,000 a day practices were very high stress, high pressure. The dentist really had to work very hard. It was like the dentist was under a lot of pressure almost all day long. Whereas in the highly productive practices, the $7,500 a day practices, the dentist really almost walked around and just had everything done for them. So it was very low pressure and low stress. And yet when I try and explain this to dentists, especially those who are at that lower end, that $2,000 end, that it's not that hard to produce significantly more dentistry. They always say, oh no, I wouldn't want to work that hard. But actually they've got it exactly wrong. The more dentistry you produce, the better you get at your skills of productivity and time management, the easier it becomes for all concerned. Well, what you find is that in a practice that's producing, let's say, $2,000 a day, it's very chaotic. How things are done is not systematic. Things haven't been thought through. So let's take a simple example. Let's say you want to set up and do a root filling, which is a common thing when someone comes in with a toothache. In a $2,000 a day practice, and I've worked in one, I said to them, okay, this person needs a root filling, let's go, let's get it done. And so the nurse then starts to set up. And so what she does, she starts opening drawers and she gets out one of this and two of that and one of that. And then she heads off to the sterilisation area and she has to start getting things from there and collecting everything together. And in the worst practice I've worked in, it actually took 16 minutes of the nurse setting up before I was ready to go with the root filling. So that was 16 minutes of my clinical time spent just sitting there doing nothing, just trying to make chit-chat with the patient instead of getting on and doing work. Now let's take the opposite extreme when you go into a highly productive practice. In that sort of practice, you say, let's do a root filling, and immediately they hand you the local anaesthetic. So you start administering the local anaesthetic. And then as you're doing that, they reach in the drawer, grab a box that has all the instruments and things you need for a root filling, open the box. By the time you've finished giving the local anaesthetic, they've got everything you need ready. So you just go from one thing to the next with no stress or fuss. Everything's just happening and appearing for you as you need it, but without that sort of delay that you find in the really badly organised practices. Well, I just gave you one about the long setup times, and that is absolutely universal in the badly set up practices. The other thing I notice is in the low productive practices is the level of staff training. What you find with them is they're not proactive. They're not listening to what you say. They're not watching what you do. So that you might say, okay, well, we're going to do a root filling, but that's not enough. You then have to turn to them and say, now set up for a root filling. So you're constantly instructing the staff on what to do, reminding them, picking up on what they're missing and what they're forgetting. You have to say, oh, you've forgotten to put out the handpieces. Oh, you've forgotten to put out the burrs. So they've got no checklists, no balances in place to make sure that they do things correctly. The other thing in the lowly productive practices is the dentist finds themselves doing a lot of tasks that can be delegated to the staff. For example, in a lowly productive practice, almost universally, The dentist has to fill in the lab sheet. The dentist has to write referral letters. The dentist has to fill in all the clinical notes. So all these things, you're just constantly being drawn away from doing dentistry and working with patients into doing extra tasks support staff could do. Well, in that type of practice, as I said earlier, the dentist's life is very easy. You don't have to do any tasks that the staff can do. You never have to write a referral letter. You just say, I'd like to send this patient to the gum specialist, and it all happens. You never have to write a clinical note. You just talk with the patient, and as you talk, all the notes are typed into the computer beautifully. You never have to fill in a lab sheet. They're all just done perfectly. You tell them once, on back crowns, I do such and such type of crown, I do it with this type of margin, and I like this material, and then they remember, and it always happens perfectly every time. When you're setting up for procedures, it's very rapid, as I mentioned. Setting up for a root filling might only take 3 seconds. They've always got the local anaesthetic ready for you. They learn your preferences with respect to long and short needles and types of anaesthetic, so they're not constantly asking you questions, asking you what do you want set up and all this, because after they've seen you do it a few times, they know. They learn your preferences with bond, impression materials, all these sorts of things. So it becomes almost like this non-verbal communication. You just say, we're doing such and such, and everything just happens magically around you. The staff just swing into action. You don't have to say another thing, and all the instruments and material just appear in your hands as you need them. And that's why you can go so fast in these practices, because you're not waiting on anything. And that's why it's so little stress, because once you sit down to work on the patient, you can just focus on the patient. You can focus on their mouth. You can focus on the work you're doing. And whenever you want an instrument or some material, you just put your hand out and the correct instrument or the correct material appears in your hand. So that's really the key in these very productive practices. They've streamlined every system so that you don't have to worry about a single thing. Well, there's really 2 choices here for a struggling dentist to sort of go to the next level in terms of productivity. They can actually just start thinking about it themselves, like they can start streamlining all their systems. So they have to take apart every system, like let's say we're doing an occlusal restoration. They have to look at, okay, what happens? The local anaesthetic, the drills, the bond, the finishing, all those steps. And then look at them and say, well, how can we make things more efficient? How can we make things work better? How can we get dead time out of the procedure? So it is possible to actually do it yourself. But the problem is, if you're not that way inclined or you don't have that knowledge and inclination, it's like reinventing the wheel. It'll take a lot of effort and you'll probably get bogged down halfway through the bit. The other way is just simply to find a mentor, somebody who knows about how to work efficiently, who's been there, who's done that, who's set up a practice that's produced major dentistry, and really follow their advice. Listen to what they say. If they tell you to set up like this, set up like that. I've been into practices where almost overnight I've been able to revolutionise one of the simplest things is setup times. I'm going to just tell them, get a box and here's how you lay it out, here's what you put in it. And they've gone from these 16-minute setup times, like I mentioned earlier, down to 3-second setup times, just almost overnight. So it's all those little things, those tips. You can either do it yourself, or you can find a really skilled mentor and follow their advice.